it's time for TIPisodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
A Tale of Two Hygienists presents this week's TIPisode, mini episodes giving you the tips to be successful, delivered straight from the experts. This week, sponsored in part by GC America.
Hello, my name is Amber Auger. I'm a practicing dental hygienist, international speaker, and creator of Thrive in the App. And today I have the privilege of bringing you a TIPisode from our friends at GC America. Now, I know my friend Raphael briefly touched on the GC America Saliva Check Buffer Kit in his last TIPisode. However, I want to pick up where he left off. I have recently become obsessed with saliva. I think as a profession, we don't address saliva as much as we should. We know many patients suffer from xerostomia, but we don't often address the pH of their saliva or its ability to buffer. And this is where the GC America Saliva Check Buffer Kit comes into play. So when I first found out about this kit, I was really shocked about how many things it really allows you to address. So the kit allows you to address hydration, salivary consistency, resting pH, stimulated saliva flow, and stimulated pH, as well as the saliva's ability to buffer. So when we look at that first segment, the resting saliva, this really looks at pulling down that lower lip and allowing saliva to pool on that lower lip and see how long does it take for the saliva to start flowing. So you can take a small piece of gauze and observe the buccal mucosa under a good light. And if the saliva is, there's greater than 60 seconds to get saliva on that buccal mucosa, this is a low resting saliva. Then when we look at the saliva consistency, we want to identify, is it watery, which would be good, right? That's normal viscosity of saliva. Is it frothy and bubbly saliva? That would be increased viscosity. And then is it sticky, frothy, residue-y type saliva? And of course, that is going to be the increased viscosity as well. So we always want to be looking for that watery, clear saliva. You may have seen this in patients when you are using a traditional prophy cup and you start polishing and all of a sudden there's these strings of thick, disgusting saliva that fly around. That's when you know your patient is, of course, dehydrated or is suffering from some sort of decreased saliva flow in general. And then, of course, we look at that pH of the patient. And what we do is we instruct the patient to spit into a collection cup, and we take the pH test strip and place the sample on the resting saliva for 10 seconds. And then you're really looking and seeing what color. So if that color is, we're looking to test if it's acidic, is it moderately acidic, or is it healthy saliva? And this is essential when we look at the patient's overall risk of tooth decay. And we also want to be looking at, how long is it staying acidic for, right? Is it staying acidic for hours on end? If so, that is going to be something where if that patient is taking a sip of coffee, but the saliva is unable to buffer back up to an area that is not acidic, of course, it's going to increase their risk of tooth decay, but it also increases the activity of the periodontal pathogens if that saliva is acidic, if that pH is acidic. So you can also test the stimulated saliva flow with this kit, as well as the buffering capacity, again, that ability to buffer with the patient. The patient shouldn't eat or drink for an hour before, so this is a great opportunity to use your patient reminder system before they come in and say, hey, today's the day we're testing your pH. Oftentimes, the next question that I get when I bring this up in my lectures is, of course, how many patients should you do this on? I personally believe that this should be done in every new patient appointment as an overall view and assessment of the patient. And then for our patients who maybe had a low pH previously or low ability to buffer previously, then you can do this, each and every time they come in until it gets healthy and really use your clinical discretion. When we look at the findings from this, the goal here is always to alter the biofilm environment, right? So once you find out, okay, is that pH low, we have to think, how do we buffer that pH up? How do we help that patient? How do we train that biofilm to work for the patient and not against it? So this is where we look at arginine. This is a key substrate in saliva that allows the pH to not only rise, but it also helps the bacteria really metabolize negative interactions overall. So it's going to boost the pH of the mouth. It's going to produce ammonia, which is good for the mouth, and is going to facilitate more good bacteria growth. When we look at if it's acidic, we can have them rinse with baking soda or implement a baking soda toothpaste in their everyday routine. This is where we look at xylitol, antimicrobial rinses. And this is also where we look at implementing a stabilized chlorine dioxide. So there's so much that we can do for the patient to overall protect them against that tooth decay. Now, in order to properly assess the patient, I do believe that we should be testing the pathogens in the saliva as well. This kit does not test the pathogens, but I do believe it's really important, and I just wanted to make sure we're clear on that. There are two different tests here, but I want to also ensure that we want to be testing the pathogens to determine what the patient's overall systemic risk is and their susceptibility to periodontal disease, even if they are not currently bleeding. There is a new test that is amazing for that. Feel free to reach out to me. I'm happy to discuss that as well, because again, I have become saliva obsessed. Hashtag summer of saliva. When we look at this, we've been measuring soft and hard tissue destruction after it has happened for years. That's been our standard of care, and I'm on a mission to change that. It's time to step into the greater ability to identify the root cause and truly prevent oral diseases. I want to thank GC America today for having me, and of course, A Tale of Two Hygienists, my favorite podcast. And of course, reach out to GC America, learn more about their Saliva Check Buffer Kit right at gcamerica.com. Have a phenomenal week.
A tale of two hygienists.